The development, it occurs in following stages. The first is the pre-dental period, second deciduous period, third mixed period, and fourth is the permanent dentition period. Now let us discuss the pre-dental period. So this stage, it begins soon after the birth and it continues until the eruption of the deciduous teeth. So during this phase, the jaws and oral structures, they are developing, preparing for the eruption of the deciduous teeth. The second is the deciduous dentition. So this stage marks the eruption of the deciduous teeth, commonly known as the uh, baby tooth. So this process typically begins around the 6 month of age and continues around 2 to 3 years when all the primary teeth they have erupted. The next is the mixed period. So this phase involves the transition from the primary to combination of primary and permanent teeth. So it begins with the eruption of the first molar, first permanent molar around the age of 6 years. So let us discuss all the stages one by one. The first is the predent, predental period. So it is indeed the phase after the birth where the neonate does not have any erupted teeth, and it lasts for around 6 months after the birth. So during this period, the infant oral cavity undergo important developmental changes. So let us discuss that. First of all, at the birth, the alveolar process, they are known as the gum pads. So gum pads, remember, they are pink, firm structures that are covered by dense fibrous periosteum. So these parts, they have two parts. One is the labiobuccal portion and the lingual portion that are separated by the groove that is known as dental groove. So gum pads, remember, they are horseshoe shaped, and the gum pads, they are horseshoe shaped and are divided into segment by the transverse groove. What is the gingival groove? It separates the gum pad from the palate and the floor of the mouth. So there are specific grooves that are known as a transverse groove. So these transverse grooves will divide the gum pads into segments, each containing developing sac of the deciduous tooth. Apart from that, there is a lateral sulcus. So lateral sulcus, it is found between the canine region and the first deciduous molar region. So it is important in determining the inter-arch relationship. So lateral sulcus, it is found between the canine and first deciduous molar, and it is important in determining the early inter-arch relationship. Both the upper and lower gum pads, they are somewhat similar but differ in width and length. The upper gum pad, it's wider and longer than the lower one. So when upper gum pad and the lower gum pad, they creates a complete overjet around the mouth. Contact but occurs between the upper and lower gum pad in the first molar region, and a space, it occurs in the anterior region. So this space between the upper and lower gum pads in anterior region, it creates infantile open bite. So that is considered normal during the early stages of development. So this open bite, it is advantageous for, remember, suckling, and it gradually diminishes as the teeth erupts. So at rest, an anterior open bite, it is observed with contact only in the molar region. The tongue may protrude anteriorly through this space. However, as the primary teeth erupt, there is gradual closure of the intermaxillary space. So this characteristic, it is considered a self-correcting anomaly of the developing dentition, and it tends to resolve as the primary teeth emerges. Apart from that, there is complete overjet that is observed around the mouth. This is normal characteristic during this stage of development. A class 2 pattern. Remember class 2 pattern, it is evident with the maxillary gum pad being more prominent than the mandibular gum pad. Now let us discuss about the natal and the neonatal teeth. So natal teeth, they are present at the birth, whereas neonatal, they are seen after the first 30 days of the birth. So remember, 90% of the teeth of the uh, early erupted teeth, they are primary, of which 85% they are the mandibular incisors teeth. Now what can be etiology? Sometimes the tooth germ is positioned superficially that leads to early eruption. Due to some conditions, there is increased eruption rate. Uh, Hormonal changes as the infant bodies can occasionally trigger early tooth eruption. Hereditary factors that may contribute to the premature primary teeth eruption. Now, what are the complications that could be associated? Premature teeth, they can interfere with the infant ability to breastfeed or bottle feed comfortably due to the irritation or discomfort that is caused by the teeth presence. So these teeth might create a risk of infant swallowing or aspirating the teeth or the dislodged part, so that may potentially create a choking hazard. Premature erupted teeth can cause injury to the infant tongue or to the maternal breast during feeding. So that condition, it is known as Riga Fede syndrome. So where you will see ulceration on the inner side of the on the ventral surface of tongue or on the inner surface of the lower lip. That is Riga Fede disease. So it is the trauma to the soft tissue that is caused by the erupted baby teeth. So it manifests as ulceration on the ventral surface of tongue or on the inner surface of the lower lip. Now during the decidus period, the second stage is the decidus period. The development and the eruption of the primary teeth occur here. So the formation of primary tooth bud, it begins around 6 weeks of intrauterine life. So the eruption of the first primary teeth, it begins around the 6 month of age, with the central incisors being first to erupt. So the completion of eruption of all primary teeth usually occurs by 2.5 to 3.5 age of years of age. So this is the table showing the upper teeth eruption period, calcification, and the root complication and the root completion that is important for your entrance exam. So the sequence for the eruption of deciduous dentation, it is generally A, B, D, C, E. Similarly, this table represents the mandibular deciduous teeth eruption period. Now let us discuss what are the characteristics of this deciduous dentition. So in the deciduous dentition, the presence of spaces between the primary teeth, it is, remember, if there are spaces present, then they are considered normal. and it is an important part of development, dental development. So these spaces, they are known as physiological spaces or developmental spaces. So what is the function of these spaces? So the physiological spaces present between the primary teeth that helps in the proper alignment and position of the larger permanent teeth. So that will eventually replace them. So these spaces will provide room for incoming permanent teeth to emerge without the crowding issue. Now what is the location of these spaces? Spaces, it is typically seen mesial to the maxillary canine. So suppose this one is the canine and mesial to maxillary. These are present, and apart from that, in the mandibular, it's distal to canine. For the maxillary region, it's mesial to canine, and for the mandibular, it's distal to the mandibular canine. So these spaces, they are also known as, remember, primate spaces, simian spaces, or anthropoid spaces. So these spaces, they are around 1.7 in the maxilla, and mandible, it's around 1.5 mm. Now when the dental arch, they are narrow, so when the dental arches, they are narrow, there might not be enough space for primary teeth. So that results in teeth becomes close proximity to each other without showing any natural contact. So the absence of spaces in the primary dentition can be indicator of potential crowding. Crowding issues in the developing permanent dentition. So when the primary teeth, they are closely aligned without spaces, there may be higher chances of crowding when the large permanent teeth would erupt. A deep bite, apart from that, a deep bite may be present initially, characterized by upper front teeth, they are covering the significant portion of the lower front teeth. So this condition can be attenuated by fact that the primary incisors, they are more upright as compared to their permanent successors. Now, what are the factors that would reduce the deep bite? First of all, there would be eruption of deciduous molar, and wear of the incisors can contribute to reduction in the severity of the deep bite. Eruption of deciduous molar and wear of incisors, it can contribute to reducing the severity of the deep bite. Additionally, as the mandible grows forward with natural facing growth, it can help in reducing the deep bite by changing the relation between the upper and the lower teeth. Now, what are the molar relation that could be seen in the primary dentition? They can be flush terminal, distal terminal, or the mesial step. So what is the flush terminal? So if the distal surface of maxillary and mandibular deciduous second molar, they are in the same vertical plane, that is known as flush terminal plane. Mesial step, when the distal surface of mandibular deciduous second molar, it is in mesial to the distal surface of maxillary deciduous second molar. This is mesial step, and a distal step is when the distal surface of the mandibular second deciduous molar, it's more distal to the distal surface of the maxillary second deciduous molar. Next is the mixed dentition period. It marks a phase where both the primary teeth and some permanent teeth, they are present in the oral cavity. So it typically begins around the 6 years of age with the eruption of the first permanent molar. Now the mixed dentition period marks a phase where both primary and permanent teeth are present in oral cavity. So this period usually begins around the 6 years of age. So within mixed dentition period, three distinct phases that can be identified. They are first is the first transitional period. So the first transitional period, it involves the emergence of the first permanent molars and exchange of the exchange of the deciduous incisors to the permanent incisors. So the mandibular first molars, they typically erupt at the age of 6 years of age. So remember, this guidance of the first permanent molar into the dental arch, it is influenced by the distal surface of the second deciduous molar. Now the mesiodistal relationship between the distal surface of the upper and lower deciduous canine, it can be categorized into three types. The flush terminal plane, it refers to situation where the distal surface of upper and lower second deciduous molar, they align in the one vertical plane. So remember this relation where the distal surface, they are in flush terminal, it is considered a normal characteristic in the deciduous dentition. So the emerging first permanent molar may also align similarly in flush or end-on-end plane. The shift from the flush terminal to class 1 relation can occur in two ways. The first is the early shift and other is the late shift. The early shift, it happens during the early mixed dentition period. So the eruptive forces of the permanent first molar, it is sufficient to push the first and second deciduous molar forward into the arch, thereby closing these primate spaces and hence establishing a class 1 molar relation. The other is by late shift that occurs by utilizing the leeway space of nets. So in cases where the children, they lack the primate space, the emerging molar cannot move forward to establish a class 1 molar relation. So where the deciduous second molar, they fall out, the permanent first molar, they would drift easily by utilizing this leeway space. Now what is this leeway space of nets? So remember the combined mesiodistal width of the deciduous canine first and second molar. So this mesiodistal width, it is more than that of combined mesiodistal width of permanent canine first and second premolar. So this space occurring, it is known as leeway space of nets. So difference between the two is known as leeway space. For maxilla, remember, it is 1.8 mm, that is 0.9 per segment, and for the mandible, it is 1.7 mm per segment, that is 3.4 mm in total. That is what you have to remember for entrance exam point of view. Now second is the mesial step terminal. In this type of relation, the distal surface of the lower second deciduous molar, it is positioned more mesially as compared to the upper second deciduous molar. So the permanent molar that erupts directly into class 1 malocclusion. So that occurs due to the forward growth of the mandible. If the forward growth of mandible, it persists, then it can lead into class 3 molar relation. So if the minimal forward growth of mandible occur, it establish class 1 relationship. The third is the distal step. In this type, the distal surface of the lower second deciduous molar, it is located more distally than that of upper second deciduous molar. So the emerging permanent molar, it might be in class 2 occlusion. Next important term is what is incisor liability. The exchange of incisors during the first transitional period refer to process where the deciduous incisors they are replaced by large permanent incisors. So this change would accumulate a difference in the space required to accommodate the large permanent incisors. So this is known as incisal liability. Remember, it is about 7 mm in the maxillary arch and 5 mm in the mandibular arch. We know that permanent incisors will develop lingually to the primary incisors. So for them to emerge correctly into the alignment, there is a mandatory need of space in the anterior portion of both the dental arches. So that is known as incisal liability. So what could be the source of space for this incisal liability? The first is the interdental physiological spacing. Naturally, we know that spaces between the primary incisors in the region it provides about 4 mm in the maxillary arch and 3 mm in the mandibular arch. Second is significant growth occurs during the eruption of incisors and canine that causes an increase in the interarch width. The eruption of the permanent incisors labally compared to primary incisors, it provide additionally space of 2 to 3 mm. So primary teeth, remember, they are more upright, while the permanent teeth they incline about the lip, reducing the interincisal angle. So this interincisal angle it is reduced from 180 to 123 that is present in the permanent dentition. So this change in inclination would increase the arch perimeter. So that is how the incisal liability it is managed or overcome during the transition from deciduous to permanent incisors. Next comes the intertransitional period. So here this phase it is relatively stable and no changes occur. The next is a second transitional period. In the second transitional period, the mixed dentition, severe development occurs. First of all, you will notice the replacement of deciduous teeth by permanent premolar and canine. The deciduous molar they are replaced by premolar and deciduous canine they are replaced by the permanent canine. The combined mesiodistal width of the permanent canine and premolar is typically less than that of deciduous canine and molar. So this result in excess space that is known as leeway space of Nance. So the leeway space available after the exchange of deciduous molar and canine, it is utilized for the mesial drift of mandibular molar to establish class 1 molar relation. Next important point is what is ugly duckling stage. So during the eruption of the permanent canine, a transient or self-correcting malocclusion may be seen in maxillary anterior region around 8 to 10 years. So as the developing canine erupts, they will displace the root of lateral incisors and central incisors mesially. So that affect the roots of central incisors, causing the mesial displacement. So this displacement would lead to divergence of the crown that results in a temporary midline spacing between the two. So this is known as ugly duckling stage. The parents may be concerned and consult a dentist during this phase. So this condition automatically corrects as the canine erupts. So pressure shifts from the roots to the coronal area of the incisors. So the second transitional period involved the replacement of the deciduous teeth by permanent premolar and canine. The next comes the permanent dentition period. It is considered when all the permanent teeth they are seen in the dental arch. It occurs at the age of 12 to 14 years. The calcification of permanent teeth it begins at the birth, starting with the first permanent molars. So the process of calcification extend until the 25 years of age. Complete calcification of incisors occur by 4 to 5 years of age, and for permanent teeth it occurs by 6 to 8 years, excluding the third molars. The entire calcification it takes around 10 years. So by around 13 year of age, all permanent teeth except the third molar, they will be erupted. So this table is important about the root completion eruption of the permanent maxillary and mandibular molars. Now, what are the important features that you can see? The first is the class 1 molar relation. Second is the overjet decreases throughout the second phase of life due to greater forward growth of the mandible. Other is the curve of P. It develops during the transition to permanent dentition and stabilizes in the adulthood. So that refers to the natural curve in the alignment of teeth from front to back of the mouth.